Hello everyone, I'm Jinyu. Welcome to Jinyu Talks about spleen and stomach. Have you ever noticed a situation where you experience inexplicable stomach pain and you feel nauseous and vomit every now and then, alternating between constipation and diarrhea? And feeling weak all over? When you go to the hospital for a checkup, whether it's a colonoscopy or a gastroscopy, nothing is found. The doctor might tell you that there's no problem with your stomach or intestines. It might be the winter season affecting your mental state. Since the doctor says there's no problem, many people feel relieved. But is there really no problem? I want to tell you that it's not that simple. Your stomach and intestines might have issues that haven't been detected yet. I have a friend who has always had a poor stomach and intestines. When he was young, he often felt unwell, sometimes with diarrhea, sometimes with constipation, and he would experience bloating and stomach pain when eating hard food. But the hospital couldn't find anything wrong, so he would just take some stomach medicine whenever he felt pain. And after the pain subsided, he wouldn't worry about it. Until later, the discomfort in his stomach became more severe and frequent. Once we were eating together, and when ordering, he complained to me about his stomach being uncooperative. I told him to go to the hospital for a checkup. He laughed and said he had been checked and was fine, and he needed to take better care of himself. He even said he had been paying attention to his health. I asked him how he was taking care of it, and he said, "Look, I don't eat chili peppers. I don't eat cold things. And I eat very little at night." I told him that not harming your spleen and stomach is correct, but this kind of care is not enough. We need to balance the intestinal flora. I suggested he use superoxygen complex bacteria. This friend of mine listened to my advice and thought it made sense. If you're not feeling well, you should actively take care of your health. After a while, when we met again, I asked him how he was doing recently. He said, "You know what? I haven't had those problems for a long time without realizing it. What you said is quite magical. I've taken a lot of little white pills over the years, but they didn't solve the problem. Do you all know why? I believe many of our fans have also encountered this situation. Many people with stomach discomfort go to the hospital for a checkup and can't find anything. Many people say that illness is serious, but if you can't find a reason for the discomfort, whether it's pain or bloating, and the hospital can't find anything, all the organs in your body are fine. So you should tell yourself that sometimes the test results and indicators really can't show anything. And everything is within the normal range, but you still feel uncomfortable. If you tell your family that you're not feeling well, many people won't understand, and they'll think you're being too delicate or making a fuss. And the doctor will tell you that if you keep going like this, you should see a psychiatrist. But we really can't see any damage or lesions through gastroscopy or colonoscopy, nor any inflammation, and all the indicators are fine. So when can we find out? For example, superficial gastritis, erosive gastritis, atrophic gastritis. Ulcers, you can see these pathological locations. Sometimes you can't see them, and you just feel uncomfortable. Let's use life science to explain this phenomenon. What do we call it? Gastrointestinal dysfunction. Many people may have this situation, thinking it's because of irregular eating or a bad mood, and they don't take it seriously. But I want to tell everyone that gastrointestinal dysfunction is not a trivial matter. If you don't take it seriously, you're making a big mistake. Because I often say that spleen and stomach diseases are not minor illnesses. Because gastrointestinal dysfunction must be taken seriously. Because gastrointestinal dysfunction is like the recessive and dominant inheritance in genetics. It carries genes, one is manifested, and the other is not. So through scientific instruments, we can see the real thing. But gastrointestinal dysfunction, you can't see it on the surface and you can't find anything. In simple terms, gastrointestinal dysfunction disguises itself very well, just like a poisonous snake hiding in a cave, hiding very deep. You can't see it, can't see it. Is there no danger? That's not right. Over time, the disease will become more and more severe. Have you noticed that many young people with gastrointestinal dysfunction often end up with severe gastritis or enteritis and even ulcers? Think about it. Is this the case? So, if you can't find any problems and you ignore gastrointestinal dysfunction, it's wrong. It's terrible when the problems become more serious. So, the transformation of gastrointestinal dysfunction into various stomach diseases or other diseases is a very long process. I'll tell you, it's not very long. Some people in 3 or 5 years. Some people may not know when the examination is nothing, but when they get older, they find a lot of problems. Many young people have very poor stomach and intestines, but why do some people deteriorate quickly and some slowly? Let me tell you, let's take a simple example. You know rabies. The virus carrier was bitten by a dog. You register rabies vaccine, right? It's not conscious onset. It may be a latent period of 10 days to half a month. It may be a few years. These diseases are different. And gastrointestinal dysfunction, I'll tell you, if the disease occurs, the time is also uncertain. It depends on your own immune capacity. If you have symptoms of gastrointestinal dysfunction, we must pay attention to it and don't think that when the body is young and appears symptoms, ignore it, and it will be serious later. Everyone says, what causes gastrointestinal dysfunction? In fact, modern medicine also has an explanation for gastrointestinal dysfunction. I don't know if you have heard of such a name before, called gastrointestinal neurosis. It is caused by mental factors such as middle-aged people with old and young, family trivial things or more, worry more, anxiety and tension. Many people, especially in old age, children are not around, life is lonely, and the mood is depressed and irritable. Coupled with irregular diet, it leads to our gastrointestinal dysfunction. This phenomenon is more common, so everyone thinks, is it right? So who doesn't have a little trouble in this world, right? So don't take too much to heart, but is gastrointestinal dysfunction really related to mental factors? To be honest, I don't completely agree, but I have to explain to everyone. For example, mental factors lead to what? Symptoms of abdominal distension, abdominal bloating, and abdominal pain caused by gastrointestinal dysfunction. Because mental factors first induce intestinal flora disorder. After the intestinal flora is out of balance, it will cause gastrointestinal dysfunction. Speaking of hygiene, the first thing is that we can see the condition of the gastrointestinal wall and its surface through gastroposcopy and colonoscopy, and even we can do tests. And there are many colonies. Before it causes a serious situation in the gastrointestinal tract, it can't be found at all. So the flora has problems and it's making trouble inside our gastrointestinal tract. and the doctor can't find it before it causes a disease. This is also the reason why we can't find gastrointestinal dysfunction in the hospital. The second thing is that many people know that bad emotions will hurt the body, but how do they hurt it? It can be said that all kinds of bad emotions will affect the energy and nutrition of harmful bacteria in our intestines. The more angry we are, the more harmful bacteria there are, and the more negative emotions there are. The vicious cycle. Harmful bacteria will reproduce and produce a lot in the body. Think about it. Is our intestine surface so big? If harmful bacteria reproduce a lot, isn't there no place for beneficial bacteria? If there are more harmful bacteria and fewer beneficial bacteria, won't we fail in the competition for nutrition? Naturally, problems will appear in the long run. A large number of harmful bacteria release weak toxins, attacking our stomach and intestines. Then we will naturally have constipation, diarrhea. For example, when the familiar E. coli increases greatly, it will release toxins. Will we have fever, abdominal pain, vomiting, and diarrhea? And in severe cases, there may be bloody stools with diarrhea. Everyone will think about it. For a long time, this kind of phenomenon, you can't check, don't adjust, then say your stomach and intestines can bear it. Can you not have a big problem? Even if our stomach and intestines are made of iron, you hit it every day. It will deform one day. So sooner or later there will be a problem. If you have the same symptoms of gastrointestinal dysfunction as my friend and you can't find anything in the hospital, you must pay attention to regulating the intestinal flora and supplementing probiotics. And when supplementing, you must remember to have bifidobacterium acacia and lactobacillus acidophilus. When supplementing probiotics, you must remember to have strong probiotics. For example, lactobacillus acidophilus is not only not afraid of a little acid, but also not afraid of heat-resistant spore-forming bacillus. They settle in large numbers in the gastrointestinal tract and can drive away harmful bacteria that release toxins. In this way, harmful bacteria will not be able to harm our stomach and intestines. Then the phenomenon of gastrointestinal dysfunction will naturally disappear. If you have symptoms of abdominal distension, diarrhea, bloody stool, and other pain, then in addition, we must pay more attention to gastrointestinal dysfunction. Maintain a good mood. Maintaining a good mood is a manifestation of our health. In this world, there is no insurmountable difficulty, no unsolvable problem. It's a good day to be happy, and it's also a good day to be unhappy. The days are getting better and better. You must do a good job of psychological construction for yourself and not add burden to the body. So, if the heart is not good, depressed and irritable every day, the mood is depressed, it is a double blow to the body. We should have a good mentality. Pay attention to diet. Among them, middle-aged and elderly friends should eat more easily digestible foods containing dietary fiber, and eat less irritating and fatty liver. When you are free, go out for a walk, sing and dance, exercise. It's very good. So I suggest that everyone should maintain a good attitude. Solve problems as soon as possible. We say solve early, prevent early, avoid the disease from getting worse. Well, today I have talked about the new Chinese medicine diet nutrition culture with you. If you still have corresponding problems, you can also leave a message for me below the screen. Well, thank you all for watching. I hope you subscribe to my channel. and see you next time.